One, go.
Adolf Hitler, the Nazi Party. Joseph Stalin, the Red Scare. Everyone's a communist. Satanic doctors and nursing staff, overcrowded and gloomy waiting rooms, socialized medicine. After doing extensive research on this topic, I've learned that these are just some of the propaganda tactics used to persuade Americans not to reform healthcare. However, actually none of these mantras are true and can accurately describe what free healthcare would be like in American society. Jeff Fox, September 29, 2013, Socialized Medicine, the horror movie, page 1, paragraph 2. Healthcare can only be made free if paid for by or with tax revenue, so that comes right out of the taxpayer budget, so that's everyone. And this process is referred to as the socialization of medicine. And so the term free healthcare and socialized medicine can be used interchangeably. There's no difference. But socialization implies or relates to communism, which scares off people. However, free healthcare is a more accurate term to describe what the healthcare change would be like in America, and seems to turn some heads. Life is extremely valuable. Maybe not for people such as Evel Knievel, but normally safety is number one concern. The way healthcare is now, it's a tedious hassle involving paperwork and forms, and it's also a stressful financial burden. So healthcare should be regulated by the US federal government and be free to the public. The problem is, this is a matter of life and death. It's not some profitable, private, free market competition. Healthcare is a human right, and everyone needs to feel safe. It provides us with peace of mind. Getting sick is inevitable. Even the healthiest people catch the common cold sometimes. Now, everyone needs this healthcare and insurance, but not everyone can afford the major medical costs. Paul Krugman, July 25th, 2009, Why Markets Can't Cure Healthcare, page 1, paragraph 3. Someone's economic value should not determine the quality of service they get or they receive in terms of healthcare. Almost 50,000 people die each year in America just from the lack of healthcare. Andrew Wilpert, December 2009, Health Insurance and Morality in U.S. Adults, page 2295, paragraph 5. My dad almost lost his life. He had diabetes for many years, and he was never diagnosed, and therefore he never was treated. And when his blood sugar levels and blood pressure levels skyrocketed and went off the charts, he was almost completely immobilized. He never went into the doctors because he didn't want to pay money just to go in and them tell him, oh, you're fine, symptoms will pass, because that's what he was thinking would happen. But would he have gone in for a checkup and been able to identify and solve the problem if healthcare was free? Of course he would have. For this reason, free healthcare is a must. The solution? Reform healthcare. America is the only developed nation without a free healthcare system. But don't worry, there are 5 easy, simple steps to reform healthcare. Morgan Griffin, September 2nd, 2009, 5 things to do about healthcare now, page 1, paragraph 9. The first step is to just get informed. Educate yourself, do some research. The second step is to talk with your doctor. Medical professionals are usually already educated about it educated about the healthcare system because it directly affects their salaries. Third, understand your current coverage. You have health insurance, know what's covered under it. Fourth, ask yourself the question, how could your healthcare be better? And then come to the conclusion that if it was free. Fifth, speak out. Getting the word out is probably the most important and most effective step in actually doing something for reforming healthcare, because there's strength in numbers. Now imagine a world where a family member is ill, passes away, and while you're still heartbroken over the loss, medical bills start to pile up, and on top of that, you have the emotional and financial cost of a funeral. That is how America is now. Or imagine a world where you have a fever imagine a world where all medical attention and medicine is free, such as what I have here. All of this probably costs about $200, and that's just a month's supply. And it's not even the average amount of medicine many people require just to function. Imagine if it was free, and medical attention in general. Imagine you have a high fever and check into the hospital immediately, and you find out that nothing's wrong, but it wasn't a waste because it didn't cost any money. And you didn't have to fill out any forms, so it wasn't a hassle. Or more seriously, imagine you having a life-threatening illness, and instead of letting it develop because you don't want to go into the hospital and waste money because you think it's all fine, but actually you check yourself into the hospital and immediately you get attention and you get diagnosed and then you get treated and then you get cured, all no cost. That is how America should be and will be with free healthcare. So get involved, go get educated, talk with medical professionals, and most importantly, spread the word about reform. People have no issue paying more taxes if they, first of all, know where their money is being spent and is beneficial to themselves and the community. Also, if medical bills are completely eliminated, because that's the largest financial cost anyone pays in their lifetime. People have been lied to about socialization of medicine, but will respond and advocate once the truth gets out. I know that college students are lazy, and on top of that, they already have a lot on their plate. But this is dealing with the most important aspect of life, which is living it. So do not just be active, do not just bystand. Do it for yourself, do it for your neighbor, and do it for the nation.